It's a double-edged sword because, of course, they're not perfect. They're not that good at medical grade equipment. They could be actually as good as medical grade equipment, but often, this company has a tendency of wanting to just do something really easy and cheap, which is logical. And one of their major weaknesses is that most of them measure movement. And movement is not sleep. If you don't move, you're really relaxed, it's going to score you as sleeping. And of course, that's a problem. So it has a tendency of overestimating sleep if you are not moving, and underestimating sleep if you have sleep apnea or some movement during sleep. So it's far from being perfect. But where it's good, I think, is to just look at their general sleep habits, from one day to the next. So maybe, my sleep is not perfect, but from one day to the next, it will stay not perfect. And then if it gets much worse or much better, when compared to a night before, I think it's pretty reliable. And also, it kind of gives you an idea of the sleep habits of people. So I actually use them to just try to see how people are doing consistently over time. I think they're less good to kind of tell this patient has this problem, this patient has this problem, but to see how people are consistent, I think it's pretty good. And also, I think they're getting better and better. It's just a matter of time before they will be able to do pretty much everything that we do with a normal sleep study. So there's already some devices that can, measure sleep that you can wear at home. They are not very convenient right now, but some of them are becoming like wearables that you can, like a little helmet that you can wear. And I think it will be more and more possible to do that. What I see as a future is kind of a composite. There will be like a ring to measure the oxygen, for example, for sleep apnea. Then you will have the EEG to look at your brainwave. Then you would have maybe a little actigraph for your legs to measure your leg movements. And depending on what you need, you can take one or the other, and everything will be on your iPhone, and it will be, again, automatically analyzed.